All right, Zach, hello, how you doing?
Good, how you doing?
I'm gonna steal these. I'm Joe Kalis, Director of Marketing with Encore Healthcare, and here is Zach Gantt, Founder and CEO. We just got back from Iowa. We were in Waterloo at the VGM Heartland Conference, and you've been there. How many? I didn't ask you this. How many years have you been at VGM Heartland?
Many years.
Many
Years. I don't know how many. Been to
Many.
Waterloo many times.
Good deal. It was a good time. It was my first time. I got the badge and everything, but we were coming here to talk about the NCD for NIV that came out from CMS. But Heartland's an amazing conference. We are vendors of Heartland or VGM. They host that thing. They've got many members of DMEs in the respiratory space and also mobility and other things. So we saw a lot of old friends, and it was a good time. What was your favorite part of Heartland? I guess I could just say.
I would say my favorite part of Heartland is it's not just a conference, it's a hospitality and family-oriented event where everybody's just like a big family. And the great thing about it being in Waterloo is that everybody spends time together. It's not like you're going out looking to do something like conferences in Vegas or something like that. So it is my favorite event of the year and always has been for a long time. So we love VGM, love those guys, and love that conference.
Good deal. And I know we saw Rhonda and Boone and all the guys that we usually talk to in podcasts. We've got a podcast coming up on the 25th.
Yeah, June 25th to talk about the NCD for ventilation, but we didn't want to wait that long. We thought it was important to talk about it right away because it's live, and so we need to have some discussions right away, and we'll continue to have these discussions and put out content about it.
Yeah, which is why we're sitting here today. It's Friday. We were there Tuesday through Thursday. We got back yesterday. The CMS just put out their official NCD on Monday. So Monday it dropped. Everybody saw it. Everybody's kind of running around a buzz. And then Tuesday, you had a 9:45 speaking slot with a slideshow that you had to modify Monday night.
Yeah, so the talk was on ventilation, the future of ventilation, which was the perfect topic for this. And really, we knew back in October that this could happen. And so when we submitted our talk at the end of last year, the whole thought was, hey, this could drop, and if it did, we want to be prepared for it and get the information out there. We obviously didn't know the timing would be the night before, the afternoon before, but we scrambled and kind of put together the presentation to help people understand what's in the NCD. It's better, but it's better than the proposed rule, but it's still not great, and so it's going to take some big adjustments for DMEs.
Yeah, and today we're gonna break down the general concept of it's better but it's still tough sort of concept. But over the few weeks ongoing here, we're gonna have a lot of resources, a lot of documents, a lot of more interviews, a lot more collateral, and really we want to be known as the people who know how to navigate through the NCD. A lot of people at Heartland were like, oh my gosh, how does this look? What are we gonna do? And for patient care, it's very serious what they put in place. And I think just from an outsider, just new to the company, it's cool to know that in 2000, Encore started 2015, but Nexus was launched in 2018. Mm-hmm. And Zach tells the story every talk, but he told it on Tuesday. He came up as a respiratory therapist and saw some gaps in the industry where Nexus was born, basically creating an outcomes-based management platform for mostly COPD patients, some neuromuscular things like that. So Nexus was born from the idea that we should have better outcomes through data. Yeah. And 2018, that was pre-COVID, so it was like a whole different world, but you knew that this day was coming. Now we're 7 years down the road, we've got 7 years of data. Nexus, I know, has tracked over 150,000 patients, over 3 million assessments on our platform, and so we, as much as anyone, are kind of like, oh my gosh, what do we do? But at the same time, we knew it was coming, and Nexus is available to tie into people's systems to honor some of the things that CMS is now requiring. So
yeah. Well, I'll just say when I first got into non-invasive ventilation for COPD patients, it was probably 2009, 2010, and it was nobody else in the country was really doing it at that time. There were a few companies out there doing it. And it really was born from this idea of everything we did in invasive ventilation, and why would we ever ventilate a COPD patient invasively when we could do it non-invasively. And so when I got into that space, the one thing I knew was that once over the next couple of years, more and more companies got in, utilization started to go up. Obviously, with anything, some people abuse the system and put patients on that shouldn't have been. And so we saw the writing on the wall really early that said, hey, one day, if you've been in DME long, when utilization spikes and OIG starts putting out reports like they did back in 2020 or 2019, that there's gonna be a change coming. And so our push for all these years, even before we started Encore, was that we got to be prepared, because think about the rest of the world around us in healthcare. Everybody else is getting paid by quality outcomes or data, right? Hospitals, home health, physicians. I mean, if you look at all the data out there, 50% of the revenue physicians are making across the country is coming from value-based care. So everybody around us is getting paid based on data, outcomes, and value. And so why would we think that DME would be excluded from that? Because we are the epitome of fee for service. We get paid for a product that gets dispensed. But at some point, there's going to be a value discussion or value payment around that. So our shot over the bow, me and Ty Bello used to do this talk called Talking About the Future and Where It Was Going. And it was, we called it the shot over the bow, the warning shot, that this is coming, it's going to happen. It's like competitive bidding. We knew about it for a long time as an industry, and oftentimes we waited till it was kind of too late to try to prepare, and a lot of people struggled because of that. And so the shot over the bow for the last 10 years has been that the day is coming where data and tracking is going to be more and more important in our industry. This is just, I believe, this NCD for ventilation is just scratching the surface for what we eventually will have to do or have to be a part of, and we should strive for that now and not wait until we're forced. And that's the other thing for years we've been saying, is that if you wait until the rule comes out and we're forced to do it, it's going to be a whole lot harder to catch up and to be able to change your business model to prepare for that. So there's a lot of companies out there that are well prepared for this NCD, and then there's a lot that it's going to be a struggle, because it's going to require a lot more tracking, a lot more documentation, a lot more engagement with patients. And so we're going to talk about some of that here on this video.
Awesome. That perspective is great for the people that don't know who Encore is or Nexus, but we put together this playbook, NCD for NIV playbook, with a proposal, and it's my goal today to redo this entire thing, because now they put out the official the NCD. So we're going to be making adjustments with the playbook. So if you have any questions about NCD for NIV, that was published by CMS on Monday. It was June 9th, 2025. If you have any questions, we are here to answer them. We're going to talk through a couple of the high points, the bullet points, the things that you probably should be paying attention to, that you need to pay attention to. And then we can also mention how our Nexus software helps with that. So stay tuned. We're going to have a new updated playbook. I've got a comment summary where there was an open comment period about 2 months ago where everybody could say what they thought about it. We have solutions for NCD that we provide. We have feedback on the NCD itself. This playbook is full of key information, so it will be available soon, probably next week once it's redone. But until then, let's go over some of the high points of, these are your slides from your talk that we kind of threw in. Honestly, again, just to reiterate, Monday it dropped. Monday night we get into Iowa for this event. You're going to talk on Tuesday, and he pops open his laptop at 11, looking through the NCD to see what's different. So we're going to talk about the requirements as they are stated on Monday that are official today. So I don't know however you want to do that.
Yeah, so I guess the summary is that the proposal that came out, let me back up. The expert panel that came out a couple of years ago, and then there was a proposal that came out recently back in April that was a proposed NCD and was open for comment periods. And so in that, there were a lot of things that were, number one, unclear, number two, very restrictive, and then number three, it was just going to be almost impossible to navigate as HME providers. And so the industry really pushed back on that and said, look, we can't do some of these things, or we need adjustments on some of these. And the honest thing is that I didn't expect the proposed rule to change that much, because generally they don't. If you've been in this business for a long time, you know that a lot of times when proposed NCDs, LCDs come out, there's not a lot of room to change, but I believe it changed quite a bit compared to what I thought it would. And so that is a good thing, change for the better. And so a lot of the things that are in there, number one, what we saw in the proposal and what we see in the actual NCD is that CMS is asking us to track more data, track compliance, not just, this is the first time ever that I know of, and I talked to a lot of people at Heartland, that we've ever been asked to track compliance on something forever. And so that's on the ventilation side, so we'll talk about that a little bit more. But this will be the first time that that's happened. But I think it just shows the shift in CMS's mindset of that they want more data, more tracking, more value for what they're paying for. And so now they're asking us to do something we've never done. It's going to affect our business, right? And so some of the things that are in there are going to be challenging, but like I said, it could have been a lot worse. And some of the other highlights are that it's now going to be easier to put somebody on a BiPAP or a RAD device, which is a good thing. We've been asking for that for years. The medical community's been asking for that for years. It's been very restrictive and hard to put somebody on a RAD device, and so now we're seeing that that's going to be easier. So their goal with this, the shift is, because it was so restricted to put somebody on RAD, it was easier to put them on ventilation, and we saw a lot of patients going to ventilation. Well, in this new NCD, the whole idea is make it a little bit easier for patients to get on RAD devices, but still have an avenue to get to ventilation. So if you think about it, this should have been what came out originally 20 years ago, right? And so if they would have done this up front, we wouldn't be in the situation that we're in today. And so it's really about how do you get the right patient on the right therapy. Now, I don't like some of the things in it, and I know the industry doesn't like some of the things in it, but we knew it was coming, and it could have been a lot worse. That's kind of the summary thought for me. But there's definitely an emphasis on tracking data, tracking outcomes, and proving the value long-term for the patient.
I mean, we don't necessarily, we're gonna have a summary of all the specific numbers and requirements and all that.
Yeah.
We'll be putting that out on our socials and emails and things like that. I guess I would just say, Nexus has been a software platform to track outcomes forever, and it does track some of these things. So how would you say that we are positioned to help the DME who doesn't know how to comply with these things? How does our platform do that for them?
Yeah, so again, we knew this day was coming. We didn't know what would be in the NCD. Obviously, we don't have psychic abilities, but we knew that it was going to be restrictive. We knew there was going to be a compliance component, and we knew that they were going to be looking for things like symptom change. And so we have already built all of that over the last several years. We were already doing a program that's pretty much NCD compliant for the last couple of years, and Nexus already tracks everything that was in the NCD. We'll have to make a few adjustments, or we've made a few adjustments that will make it a little bit simpler to line up with the NCD. But the point is that we were already doing this for the last several years, and we have prepared for this moment. And now that the NCD's out, we'll make some adjustments and we'll improve some of that. But essentially, we are NCD compliant today. A lot of people don't track compliance long term on vent patients, or just kind of sporadically PRN. But we are compliant today with the NCD, with the Nexus platform. So it's kind of like flipping a switch and you can be compliant. Now, we know that the NCD got published, and so it's official. The implementation is what's questioned right now. When's it going to be implemented? When will they start enforcing it? And the fact is that we can all make assumptions based on history, but we don't know for sure. But what we do know is it's June 9th. It's written into, it's effective. And so that means from June 9th forward, you got to start thinking about how do you change your business, whether they enforce it over the next couple of months, because there is some leeway inside the NCD for the DME Max to be able to create local coverage determinations that either are more clear or descriptive, that would give us a little bit more information. So there's some leeway for them to make a few changes, and they left that in there. But the point is, it's live now, so you got to start doing something right now. And even if it takes us 3 or 4 months before it gets implemented completely, and they don't start enforcing it until then, well, that's not very much time to change your business model. And so theoretically, they could enforce it starting Monday.
Yeah.
And so we just don't know, and that's the challenging part of something like this coming out is, we were hoping, and the ask from the industry was that we would push it off for a year, so we'd have time to get prepared for it, but they didn't do that, and so now we're kind of under the gun that you need to become compliant as soon as possible, because theoretically, it went into effect June 9th, and so it could be enforced from June 9th, so you need to do something now, and that's why we wanted to get so much content out there. But Nexus, whether you use Nexus and we license it to you and you track your own patients, or we have a model where we track them for you, right? Where you just, again, flip a switch and we do all the follow-ups. We've got therapists licensed in about 35 states currently. We'll be licensed in all 49, I think is where we need licensure at this point very soon. But we've got therapists that are managing patients all over the country right now, ventilator patients managing compliance. We can do follow-ups. So we can do everything from the follow-up to track symptoms and to track improvement to just doing the compliance piece of making sure they're compliant. Because here's the deal, in this new NCD, in order to bill for a month, after the first 6 month period, so you got 6 months to get them compliant, and the compliance rule landed with the same as the sleep rule, 4 hours a day, 70% of the time in a 30-day period. And so that means that in the first 6 months, you've got some leeway to get them compliant. After 6 months though, they have to be compliant every month that you bill, every calendar month that you bill. So what that means is the way that we read it and interpret it, and the way that everybody else is reading it and interpreting it, it means that if you don't have 70% compliance, 70% of the days compliant at 4 hours in a calendar month, then you don't bill for that month. So say you got a patient on for 12 months, after that first 6 month period, they're on for another 12 months. If they're not compliant 3 of those months, you don't get paid for those 3 months, or you can't bill for those months, or they're gonna come claw that back. And you gotta prove compliance. So that means you need a modem on every device. I would not buy another device that didn't have modem connectivity. And so you need a modem, and you need to be able to track that data. So there's some key things that you need to start doing today. But in our programs, again, we can kind of flip the switch and be able to start tracking compliance for you and do it on a consistent basis to make sure that you're able to bill. Plus, our compliance rates are better than most companies out there when it comes to ventilation. A lot of people are doing sleep. We've never really been in the sleep space. We are the ventilation guys, right? We're the respiratory management company. And so our focus has always been on ventilation. We've managed over 60,000 ventilator patients in our software. We've got data on all those patients, and so if you think about it, you know, we've got more data and done more management of vent patients than anybody else out there. So the point is, if you want to make sure it's done and done right, then having somebody with so much experience is key, and not a fly-by-night company, because this is big money when you're talking about billing on ventilator patients, especially if even if you've got 60 to 100 to 150 vent patients. This is a big part of your business and a big part of your revenue, and so you can't risk that because you're not prepared. And that's the key, is that we want to make sure everybody understands that you can be prepared quickly. And maybe some companies might say, we want to contract with Encore, use Nexus, or use your telerespiratory services for some period of time until they ramp up their own program, and that's okay too.
Yeah.
You know, it's for us. We just want to be able to make sure the industry moves into this process seamlessly, and a lot of that is if it's outsource it for a while and then take it back in-house, that's fine. If it's outsource it forever, that's fine as well. Or if you want to use just the software and manage patients in the software with your own respiratory therapist because you've already got your own team, then that's okay too. And that's really the great part about working with us is we can be very flexible in how we do that, right?
Awesome. You read my mind. I was going to talk about telerespiratory if they don't have staff to play it out. So we will be updating the playbook with the specifics of the CMS NCD, what they require. Also, I think it would be of note, you talked about the modems on the devices. We're going to put a list of devices that we are integrated with, so that, because there's some that we're not for various reasons, and we can explain that in the playbook as well. We do have Nexus software, but we also have RTs available through our 360 services, Oxygen 360, Vent 360. But also, the length of service, when you're on Nexus and you're looking proactively at people, at patients' health, we're improved. Not only is it checking the box of CMS is asking us to track data, but there's a true benefit. We're not going to get into the pitch or the offer the benefits of Nexus as a solution, but you do need to track data for this NCD. But oh, by the way, when you do that, if you do it through Nexus, you're going to proactively be looking at patients' health and improving it and extending the length of service. That's where you talk in your talks about another birthday, another Christmas. There's a true value to patients' care through what we do. Not only is it checking boxes to fill some legislative, movement in the industry, but it's a powerful platform for outcomes-based patient care.
Well, and that's the point that he's making there, is that in our platform, looking at tens of thousands of patients, not just looking at a small population, what we see is that the length of service that somebody stays on the vent is longer. So that means that you have less pickups because you have more engagement with the patient, so they're more likely to use it. Less issues with copay, because when you feel like you're getting value out of something, you're going to be willing to pay for it. And so you have less pickups, less copay, but then you also have the patient engagement piece of when they're feeling better and they're living healthier, and we're walking through kind of a holistic approach of how we manage care in Nexus, then people feel better and their quality of life is better. And I can't say that we extend their life, because you need a randomized controlled trial to say that. But what I can say is, if you look at the national average, it's about 9 months that patients stay on vents. If you look at our average for customers who have been using Nexus for several years, you're looking at 20 plus months that they're on a vent. So what I can say is that patients stay on service longer. There's a business reason that that's good for the DME, but there's also, more importantly, the clinical reason, which is that patients get more Christmases and birthdays, less days in the hospital. We published some data last year at ATS, 17,000 patients on non-invasive ventilation. We avoided over 33,000 hospitalizations. Now, these are not small populations, small numbers, but think about that. 33,000 hospitalizations. Each one of those would have been at least 5, 6, 7 days. How many days did we give back to the patients and their families in not being in the hospital? But also, what happens when they go to the hospital? It's detrimental to their care because it's such a setback, and oftentimes they never recover back to the place they were before the hospital. So especially if they get a pneumonia or an infection during that stay. So just think about the amount of time that we can give back to a patient. Now, that's key because, number one, in this NCD, if you're looking at this from a business perspective, is it going to eliminate some patients from going to this service that normally would, right? Is it going to be harder to get somebody on service? And the answer is possibly yes. But in that process, you're going to have more patients on BiPAP or on RAD devices. And if we do this the right way, we're going to have better outcomes across the board. And I think that is the key part, is that if we get patients using their devices, engaging with them, we're going to have better outcomes as an industry. And so from a patient care perspective, I do think there's going to be some patients who might need ventilation. It's going to be hard to get access to blood gases or some of those things. But from a patient care perspective, I believe this will make our industry better if we're actually tracking the data, engaging with patients more, and making sure that we're improving on their care. So I think this is the beginning of where everything is going to go in DME, especially if you're looking at frequently and substantially serviced products, meaning that we have to see them on a regular basis and it's uncapped. So any of those categories, I believe, will go in this direction. But we're seeing a change, and I think the key is, are you ready for it? And are you prepared for this change that's now already happened, and the changes that will be in the future? Are you tracking data? Are you tracking outcomes? Are you engaging with patients? And if not, then how can we help you to do that?
Perfect. Couldn't have said it better myself. So we're going to talk about ongoing from here on out. We're going to have more videos, more training, more reports, more data. So this is just the start of explaining exactly how we can all navigate together what's going to happen. It's a benefit because you're compliant with the CMS requirements, better patient care, and it is better for the DME business. So it's a very, very beneficial situation if you were to work with us. But more than anything, we're just here to be a sounding board and advocate, a community that we can explain things to each other. We can advocate to CMS about our feedback and things. I know Rhonda, VGM's doing a lot of that. And VGM, we're tied in with them as an industry advocate. So let's just keep having a conversation. We're going to update the playbook and get it out there, talk about all the details and the devices and how you can work with us. So anything else?
No, I think
Alright.
we covered it.
Yeah, there will be more from us. So until then, appreciate your time. This is Zach Gantt, CEO and founder of Encore Healthcare, and I'm Joe Kalis, and I will be sharing more of this stuff with you soon. And have a great weekend until then, and talk to you later.